Good morning. This is Ovarian Cancer Awareness Month, and to discuss this topic, I have two excellent experts, both gynecologic oncologists. One from Houston, Dr. Aparna Kamath, who is the Division Director of GYN Oncology at Houston Methodist Hospital, and also an Associate Professor of Obstetrics and Gynecology at Weill Cornell Medical College. I also have Dr. Jill Aldridge, who is an Associate Professor of Obstetrics and Gynecology at the University of Colorado Medical Center in Denver. This is Ovarian Cancer Month, and I'm very fortunate to have two excellent experts to discuss this and talk about the problem on both sides of the globe. And I want to start first with Dr. Aldridge. Can you please talk to me why it's called a silent killer and what are the challenges in the diagnosis of ovarian cancer?
Yeah, thank you. I think that one of the greatest challenges is that the symptoms of ovarian cancer can be very subtle. And so it can make detecting ovarian cancer very challenging until it presents at a later stage. And we don't have a screening test in this space. Pap smears do not screen for ovarian cancer. So the lack of a screening test and the lack of clear symptoms until late stage disease both contribute to this being a particular challenge.
Dr. Kamath, do you see what's the incidence between, like compared to India and US? Can you comment on that?
Sure. So basically, ovarian cancer is not a very common disease. It's a pretty rare disease. In the United States, we see approximately about 20 to 22,000 new cases per year. So that means that if you live to be, up to 70 years of age, your cumulative incidence is only 1.4%, right? In India, the number of new cases per year is double that, about 47 to 48,000 per year. But when you compare the population of India, that's a much lower incidence in India as compared to the US. And I think a lot of that has to do with some of the risk factors that we will probably talk about, during this talk. One of them is, reproductive behavior. So women in India are more likely to have more children. They're more likely to breastfeed. They're more likely to have tubal ligations, less likely to use birth control. So all of those may contribute, but overall, the incidence in India is lower than the incidence in the US.
So in India, what is the more common cancer in women?
Among gynecologic cancers, obviously the most common by far is cervical cancer.
That we talked about a few months ago, yes.
That's because of lack of screening.
While we are on risk factors, do you want to talk about the risk factors?
Sure. So, I think that there are many risk factors for ovarian cancer. One of them is, like we talked about, long times of nulliparity in the sense never having gotten pregnant, early menarche, late menopause, endometriosis. But one of the biggest risk factors and that we know about is genetic family history and genetic mutations that increase your risk of ovarian cancer. So that is probably the highest risk factor, but there are other risk factors we discussed.
Dr. Aldridge, you want to add anything?
No, I think that often this is a disease of aging also. So it's something that we tend to see in women in their 60s, 70s when there's not a genetic predisposition. And there can be certain populations like the Ashkenazi Jewish population where these genetic mutations are just more prevalent. Otherwise, though, I think Dr. Kamath covered it well.
So would BRCA gene mutation checking for that, would that be helpful in ovarian cancer or not?
So, I think it's really important to stress to the audience that, yes, genetic testing is important. But, when we're talking about screening patients, like, women who don't have ovarian cancer, I wouldn't recommend just doing genetic testing unless the certain risk factors or a certain criteria are met. For example, if you have a family history of ovarian cancer, if there are many different, like Dr. Alder said, a history of Ashkenazi Jewish ancestry. If you have a personal history of in the family with breast cancer below the age of 50, so things like that. But once you're diagnosed with an ovarian cancer, we recommend that all women, irrespective of family history, should be tested for PRCA, but also other genes to look for a genetic basis.
So if there's no good screening test and, Dr. Aldrich, what would you say a woman should look out for, some of the signs, or what should she be looking for, some of the symptoms?
Yeah, in populations where there is a genetic mutation, we do have some things we can talk about as far as screening or reducing risk of ovarian cancer. And so we do want to have those conversations about ways to minimize risk in those specific populations. But in the general population who doesn't have a genetic mutation, we don't recommend any type of routine screening. And so really we're relying on symptom awareness. I tend to find that a mnemonic to remember those symptoms can be helpful. So we often think of BEAT or BEAT. So that's bloating, abdominal bloating, eating issues like a loss of appetite or getting full quickly when you eat, abdominal pain or pressure, or troubles with the bowels or bladder. And the tricky thing with those symptoms is a lot of people have those symptoms, particularly around the time of menopause. These things can happen. And we don't want to be alarmist and make everyone concerned. But if these symptoms are persisting for more than a week, I think that they need to be brought to the attention of primary doctors or OBGYNs. And there also needs to be some degree of awareness and advocacy from patients and from providers that those symptoms could represent ovary cancer and require a more comprehensive workup.
So it's kind of non-specific symptoms, but if they persist or they're not not normal for that person, then probably they need to seek attention. Can we talk about modifiable risk factors, Dr. Kamath? Can you start with that?
Sure.
What
So
can a woman do to protect? I mean, or
yeah,
to, yeah.
sure. I think that, there's certain risk factors, obviously, that you can't change. Like Dr. Aldrich said, some of this is, with aging, you can't change your genetic, profile. But there are certain protective factors, which for one of the biggest protective factors is the use of birth control pills. So, women who have used birth control pills, especially for extended periods of time, have been shown to have been shown to have a slightly lower risk of developing ovarian cancer. I think the biggest, the other things that can, as far as your reproductive history is concerned. So women who get pregnant, who are, so those women also have a lower risk. But in general, as far as modifiable risk factors, I think the biggest thing is, being aware of, symptomatology, like knowing, making sure that you see a gynecologist once a year. I think a lot of women forget to do that. And what that does is that even though it may not, just helps you bring to the forefront any problems you may be having. A pelvic exam may detect something which you may not feel, because some ovarian masses, unless they get to be a certain size, may not really cause symptoms. So I think a lot of the risk factors that are modifiable are, using birth control pills, but also getting a regular annual checkup.
What about exercise and eating right, and it's always good for anything, but does it have any role in this, or I guess it's
Well,
just a good practice.
yeah. I mean, I think that, with all cancers and with all health issues, right? So, I think having a healthy lifestyle helps in many ways. So one of the facts with exercise and with diet, it reduces your level of inflammation overall in the body and also increases your immunity. So all of that may actually help. But as far as particular diet, I don't think there's been any studies to show that a particular diet has, reduced the incidence of ovarian cancer. Now, we do know that exercise, the people who are, very physically active or they actually exercise routinely tend to actually do very much better with chemotherapy and with the treatments of ovarian cancer compared to those who don't.
So they can tolerate, better all the interventions. Dr. Aldrich, can you comment on what's the standard treatment and what's on the horizon? What can we expect?
Yeah. Oftentimes, treatment is very much guided by the stage or the degree of spread of a cancer at the time of diagnosis. Oftentimes, there's a combination of both surgery and chemotherapy, so IV chemotherapies. We are also in an era where we have some maintenance therapies as a pill that can be very, very helpful in certain populations and can really extend survival. So I do think that we have a much better standardized approach to treating ovarian cancer than we did in the past. And we can see situations where women get cures or prolonged periods of time where they're in remission. And there continues to be active research in how we improve that in the upfront setting and also how we treat recurrences.
So there is a hope with the research of, improving the survival and, in ovarian cancer. Yes. Okay.
I'm certain Dr. Kamat and myself are both very much committed to research in this space and trying to move the needle in how women do in this space. But absolutely, there's a lot of active research in this space, and particularly in how we treat recurrent ovarian cancer. New therapies are coming online regularly.
Dr. Kamath, any closing comments?
Yeah, I think that, this is the Gynecologic Cancer Awareness Month. And I think the thing to really highlight, like Dr. Aldrich says, multiple things. One is, it's really, really important to raise awareness of the symptoms because, when you compare women who are diagnosed with early stage disease, like, for example, cancer, which is confined to one ovary, their survival is almost 90%. 85 to 90%, as compared to, most of the women that Dr. Aldridge and I see, they have cancer which is already stage 3. And this is majority of the women with ovarian cancer. And so their survival is significantly lower. So my, sort of plea to everyone would be make sure you're aware of these symptoms, make sure you know your family history, because if you do, you may be someone who can get testing. And if you are found to have a genetic mutation, you can actually get surgery to prevent that risk, right, of developing cancer. And finally, there really is a lot of exciting research that is coming forth. We have a lot of new drugs. And if you look overall, across the world, the incidence of ovarian cancer actually is declining, at least in the US. And the reason for that is increased awareness, use of birth control pills, and using risk reduction surgery. So there's a lot of hope for everyone out there.
Oh, that's a very positive note. Dr. Aldrich, any closing comments?
No, I absolutely agree. I think that just having this talk, sometimes we'll call it the teal talk, right? Of talking to your loved ones, your friends, your family about what these symptoms are. We talk a lot about pap smears and cervical cancer, and that's on the forefront of people's mind when it comes to gynecologic cancer screening. But we don't talk much about ovarian cancer. So the more we can have these conversations, increase awareness of symptoms so that women can advocate for themselves, then we can catch these earlier stage. We can help people survive longer. So yeah, just talk, increase awareness as much as possible.
So teal ribbons, people, not many are familiar that teal is for ovarian cancer, right? So I think increase awareness, maybe wear those ribbons this month, and increase community education. So thank you both for joining, and I appreciate, I know you both have to run to the operating rooms. Bye, I'll let you go.
Thank you so much.
Thank you.